Welcome to the Ultimate Dentist podcast. Join us to hear success stories of various individuals and learn clinical and life hacks to help you become the ultimate dentist. Hi everyone, I hope you are all doing great. In today's short episode, I would like to discuss some of the differences between single tooth versus full mouth reconstruction cases. And I would like to discuss 7 key differences. And most of the time when I am running courses, hands-on courses or events, and I'm lecturing and I ask all the dentists, I have a slide with the bridge. One end is single tooth dentistry and the other end is FMR. And I always ask people that, what do you think the single most factor which differentiates between someone doing single tooth dentistry and making that jump into doing full mouth reconstruction? And almost everyone says occlusion, and they are correct. Occlusion is one of the most key difference between single tooth dentistry and full mouth reconstruction cases. If you're doing single crowns, if you can do bonding, then yes, you can do 28 crowns or 28 bonding on the teeth, but you need to know how you can manage to marry them together and in such a way that patient don't end up destroying their teeth, because one of the risk of mismanaging full mouth reconstruction is patient comes back with fracturing and damaging their restorations. Many times patient gets used to that, but yes, those bruxis patient, you will see that they will be destroying your restoration very, very quickly if you do not take occlusion into consideration. Along with that, they can develop many other issues, rather TMJ issues, flaring of the teeth, mobility of the teeth, and issues such as those. So occlusion is the key for doing full mouth reconstruction. However, this is where everyone comes short. People think that occlusion is the only thing you need to know when it comes to making a jump from single tooth dentistry to full mouth reconstruction. However, there are other six key things which I would like to discuss today, apart from occlusion, which you need to know. Number 1 is communication with patient and technician. And this is something very often overlooked. You need to make sure that you have really good rapport with that patient who you are going to do full mouth reconstruction, because eventually you will be literally doing treatment for every single teeth. And so the patient, when they come back and they break any restoration, you can't say, oh, this is not done by me, or this is old restoration, because you will be eventually treating every single tooth. So you need to make sure, and you'll be seeing that patient again and again and again for multiple appointments. So you need to make sure that you have a really good rapport with that patient. It's life-changing for patients. However, it can make your life miserable as well if patients you and patient are not on the same page. So I am very selective as to whom I treat, do the treatment to when it comes to doing full mouth reconstruction or full arch implant dentistry for that matter. It's not same as doing single crown, even though you don't like patient and just finish the crown and then patient's gone. It's a journey which you and patient's going to go through. And if patient's not happy, or patient's miserable, or you are not happy with the patient, or you can't get on with each other, then there is no point in doing full mouth reconstruction. You can happily refer that patient to somewhere else. Now, similarly, you need to have a really good technician who you can understand, you both can communicate. I have had issues in past where I've sent wax up to technician. I have sent them written A4 size page instructions and my treatment plan, explaining it to them how I want them to do wax up and what kind of treatment I want to do. And technician has completely ignored it and just did whatever they felt was the best thing to do. And of course, no one wants to do a bad job. I mean, most of the technicians I know, they're really proud of their work, and they really enjoy doing that work. It's just that the communication needs to be, you both need to be on the same page. Otherwise, if, let's say, for example, you're not planning to do buccal veneers, and if the technician sends you wax up with palatal, incisal, and buccal wax, and now you've done a mock-up using that wax up, patient will be under illusion that after you finish your treatment, their teeth shape will change completely and will look really, really nice. Now, you haven't quoted patient for buccal veneers, composite, or porcelain. And when you finish your palatal incisor buildup, patient will be disappointed with the results because the mock-up, it's not identical to what you're proposing. So make sure that you have really good technician, and you have good communication between technician and yourself, so that you both are on the same page. So communication is number one key factor apart from occlusion when it comes to doing full mouth reconstruction, and you can make a really, you can mess things up really big time if you're not very good and you're not very careful with that. And the other difference between single tooth dentistry versus full mouth reconstruction is that the damage you can make by ignoring few things, the impact of that would be massive if you're doing full mouth reconstruction. If you're doing single tooth dentistry, many times patient conformity dentistry, patient will get used to with that, or you can change a single crown or single restoration and everything will be fine. However, full mouth reconstruction is a completely different beast. So if you are not careful, you can really mess things up. The number two most important factor apart from occlusion is temporomandibular joint. You need to have training on assessing TMJ. Make sure that you do load testing, you assess TMJ, that vertical height you're going to increase, OVD. You need to assess that various ways to make sure that patient will get used to it, that increase in OVD. So temporomandibular joint is one of the key aspects you need to assess when it comes to doing risk assessment. And that leads to my point number 3, risk assessment. You need to be able to risk assess yourself and your cases. We discussed this in last podcast, how to do risk assessment. So if you haven't listened to that, listen to the previous podcast and you will know how I do risk assessment for all my full mouth reconstruction cases. But risk assessment is key when it comes to doing full mouth reconstruction versus single tooth. Of course, we're going to do risk assessment for single tooth dentistry. However, the implication of not doing risk assessment for full mouth reconstruction is much, much more bigger than for single tooth dentistry. So again, if you make a mistake in single tooth dentistry, it's much less magnified than when you do mistake in full mouth reconstruction. Number 4 factor. So number 1 was communication, second was temporomandibular joint, third was risk assessment. Now number 4 is treatment planning. And this is again a key when it comes to doing full mouth reconstruction. Occlusion is actually part of the treatment planning, one aspect of treatment planning. And you need to, when you are doing treatment planning, you need to really plan your cases by asking questions. Ask questions to yourself, ask questions to patients, ask questions all the time when you are treatment planning. And when I teach, I go through all the questions what I ask when it comes to when I do treatment planning, such as load testing, curve of SPE, whether teeth are in the right position. So you need to make sure you assessed all that. And occlusion again is part of that, but not the only factor. So treatment planning for full mouth reconstruction is completely different than treatment planning for single tooth dentistry. So if you feel that you're very good at doing single tooth dentistry, and because of that, without any training, you can just do full mouth reconstruction, then you're really delusional, because it's like when you are doing, if you are doing full arch implants, then you would know that, just doing single implants and very effectively and nicely doesn't entitle you to start doing full arch implants. Full arch implants are completely different beast than when it comes to doing single implants. Yes, you need to have the skills. You need to have the skills of placement of implants. You need to know how to raise a flap. You need to know how to numb the area. But even then, when you're doing full arch implants, numbing patient is completely different art than numbing patient for single tooth or few implants. And this is something I learned quite with mistakes. I thought that I can place implants, I can do really extensive grafting and bone grafting and sinus lift and everything, soft tissue grafting. I thought, okay, I could possibly do full arch implant by watching videos or listening to people. However, full arch implant is completely different beast, and that's why I have two mentors who helped me when I was starting my journey, and I still time to time take their help, because when I feel that okay, I'm slacking, or I'm not thinking enough, I go back to my mentors. So again, you need to have training and mentoring when it comes to doing full mouth reconstruction. So number 5 is training and mentoring. So number 1 was communication with patient and technician. Number 2 was assessing temporomandibular joint. Number 3 was risk assessment. Number 4 was treatment planning. And number 5 is training and mentoring, which is the key when it comes to doing full mouth reconstruction. Again, if you feel that you are very good at doing single tooth dentistry, you've done 3-to-3 bonding, veneers, you've done even 5-to-5 veneers, and you can do full mouth reconstruction, then yes, you have the skills. You have, again, I go back to the implant, that you know how to raise a flap, you know how to place implant, you know how to drill hole in the bone. But again, planning and the sequencing is completely different when it comes to doing full mouth reconstruction. So in my opinion, training and mentoring is a must when it comes to doing full mouth reconstruction, not only to get you keep you away from GDC, because obviously if something happens to your case, if you've done full mouth reconstruction, if you cannot show that you had a specific training for full mouth reconstruction, then you can land yourself into trouble. And even if GDC is not in the picture, litigation is not in the picture, you want to learn things in a systematic way, in a simple way, from someone who has done this before. Now again, it may sound this is like a promotion for my course, but it's not. I genuinely feel that mentoring and training is a key part of full mouth reconstruction. Again, I have many mentors. Still, I go back to my mentors and I discuss cases with them. And mentoring is something I actively promote, that everyone should have a mentor. However, it's like doing a driving test. You can't go and start doing driving lessons until and unless you have passed your theory test. So make sure that you learn the theoretical knowledge before you ask mentor to help you. And ideally, you need to learn the theory from the same mentor so that you understand their way of doing full mouth reconstruction or full arch dentistry or full arch implants. So again, training and mentoring is the key. However, that's not enough. You need to develop lateral thinking and critical analysis. So that's number 6. Apart from occlusion, which is again one of the factors which everyone recognizes, there are 6 other key factors we are discussing. The number 1 was communication. Number 2 was TMJ. 3 was risk assessment. 4 was treatment planning. 5 was training and mentoring. And number 6 is lateral thinking and critical analysis. Because beyond getting training and mentoring, you need to be able to think yourself critically as to what mistakes you are doing. Because even mentor cannot be sitting next to you all the time. It's you who need to evolve yourself. You learn from others and evolve yourself and try and figure out what mistakes you are doing. So that's the critical analysis. You need to really critically analyze every case you do. Till date, if I've done so many full mouth reconstruction, And if you pick any of them, I can show you mistakes I've made. I have not found a single full mouth reconstruction case where I have not made a even minor mistake. Yes, now obviously the more cases I'm doing, the mistakes becomes smaller and smaller. And now I'm going very refinement. I'm looking at the gingiva. I'm looking at the position of the alignment of the teeth. I'm looking at the at what point my occlusal contact is there. So I'm refining it a lot, and critiquing myself a lot. But even I'm raising my standards. That means that I still don't have a case which is 100% to my satisfaction, and I'm happy with that, because as a dentist we are practicing clinician. We are never perfect. And this is something I want you to take away from this, is that we are always striving towards perfection, but we're never going to reach that. And that's the journey. Journey is the one which you're looking for. So one was critical analysis, and the other thing is lateral thinking. Because no matter how good you are, no matter how much rehearsal you've done, you will get stuck. As Mike Tyson has said once, that everyone has a plan until they get punched in the face. So yes, you will have planning, you will plan everything, you will write everything down, you'll ask people hundreds of questions, but at the time you will come across issues which you will need to deal with it. And the only way it will help you deal with it is by thinking laterally. Okay, I've done this way, it didn't work, what else I can do? And once you remove the problem from the problem and think about the solution of that problem, you will be able to get an answer of any problem. So make sure you develop lateral thinking. So and the best way to do is to start developing that lateral thinking and critical analysis by when you're doing single tooth dentistry. Start doing that with single tooth, so that when it comes to doing full mouth reconstruction, you will learn how to critique yourself better. One of the best way to do that is take photographs. If I can take photographs and videos of every single procedure I'm doing, I would be much better clinician than who I am right now. It's just that physically it's difficult to take video. I mean, I take photographs of every single thing I do now, but taking videos I still struggle, because I work in different practices, and set up for the videos is difficult. But this is something I'm looking into, and if you know how to record videos, reach out to me, because I need help for helping others, but not only that, helping me, because I go back and I look at my photos, I look at my recording when I have a nurse and they're recording my surgeries or my restorations. I look back and I some things you do subconsciously which you never think about, and when you start doing it, you will only then understand what you are doing. So I hope you enjoyed this podcast. As I said, I hope I haven't made this podcast doom and gloom kind of situation. I wanted to just let everyone know that single tooth versus full mouth reconstruction is a different thing. So full mouth reconstruction, not simply doing whatever you do on a single teeth 28 times. And I see many dentists who are confident, opposite to my skill. I'm very underconfident, and I've observed, I don't know, I've observed probably 20 cases before I started doing any full mouth reconstruction. I observed someone for 2 years, and then I started doing 𝗙𝗃 technique. I really assisted someone for 2 years for 𝗙𝗃 technique, block grafting, before I started doing block grafting. So I'm always slow in implementing, making sure that I've ticked all the boxes. If you're not that kind of person, that's not a problem. Just make sure that you have a right training and right mentor beside you. So I hope you enjoyed this podcast, and I will see you in the next podcast. Have a lovely day.